January is marked worldwide as the Cervical Cancer Awareness Month. So this week in our Vaginal Talkies, we thought of talking about a very important test which every woman must be aware of and must get it done regularly. A Pap test or a Pap smear test. So hello everyone, this is Dr. Anjali Kumar once again bringing you greetings from Maitri. Maitri is a space where we talk anything and everything about women's health. So a Pap test is a test which can actually detect cervical cancer before it actually develops or even in very early stages when the cervical cancer is easily treatable. So what is a cervical cancer? So the cervical cancer is a cancer which develops in the cervix. So what is the cervix? Cervix is the mouth of the uterus, or you can say it is the opening to the uterus. It is located at the top of the vagina and it is actually hidden deep inside. You can't see it from outside. So every woman who has a cervix is at risk of developing cervical cancer. Cervical cancer is only one of the few cancers in the body for which we know a definite cause. Cervical cancer in practically all the cases is caused by a virus called human papilloma virus, HPV. HPV are almost more than 200 types and they're actually known by numbers. So there are almost 14 different types of HPVs which are called high risk, which means that they have a very high chances of causing the cervical cancer. While there are certain HPVs which are known as low risk HPVs which have a very low chance of causing the cervical cancer. HPV infection by and large spreads by the sexual route only. It spreads by the vaginal, anal, oral or even skin to skin contact. It can infect both men and women too. HPV infection can be prevented by using condoms or maybe dental dams, but not completely. Most of the people who are sexually active will have a HPV infection sometime in their lifetime. It is very common. But in most of the people, the HPV infection goes away on its own also. The body's immune system is capable of handling the HPV infection. In many of the patients, the HPV does not even cause any symptoms. Many of the people actually would not even know if they are carrying a HPV infection. But in some people, the HPV infection can persist, and in case this HPV infection is of high risk type, it can induce certain precancerous changes in the cervix, and if these changes are not detected well in time or not treated well in time, it can develop into frank cancer. Cigarette smoking, early sexual activity, multiple sexual partners, frequent sexually transmitted infections which have been left untreated, weakened immune system, HIV infection, they all can increase the risk of persistent HPV infection and hence the cervical cancer. It takes almost 5 to 10 years for the precancerous changes in the cervix to turn into frank cancer. Now this means that if we can detect these precancerous changes well in time, we can actually prevent the cervical cancer. So this is known as cervical cancer screening. This includes number 1, Pap test, number 2, HPV testing, and number 3, Pap plus HPV testing, which is known as co-testing. By doing a Pap test, we can pick up any abnormal or precancerous cells in the cervix. And by the HPV testing, we can pick up the presence of HPV in the cervix. Worldwide, by doing this cervical cancer screening, the cervical cancer rates have come down dramatically and millions of lives have been saved. So now let's understand how is Pap test done. So for this, the doctor does an internal examination, puts in a small instrument called vaginal speculum to visualize the cervix. Then a small plastic brush or a wooden spatula is used to scrape the cervix to collect the cells. These cells are either collected in a vial or the doctor decides to make a slide right away. These cells are then sent to a pathologist to look for any abnormal or precancerous cells. The same sample can also be used to find out the presence of HPV in the sample. Is the test very painful? Not really. Some people might find it little uncomfortable, but the test is not painful. How much time does a Pap test take? It hardly takes few minutes. What is the right time to do the Pap test? The best time to do the Pap test is when you are not bleeding. So make sure that when you go to the doctor, you are not bleeding. It's also a good idea to avoid having intercourse, any vaginal douching, or use of any vaginal tablets 2 days before the test. Who should get the cervical cancer screening? So every woman who is more than 21 years of age, whether she is sexually active or not sexually active, must start getting the cervical cancer screening done from the age of 21 years onwards. Before 21 years of age, cervical cancer screening not required. 21 to 29 years of age, Pap smear every 3 yearly. 29 to 65 years of age, now there are 3 options. Whether Pap smear every 3 yearly or HPV testing every 5 yearly or Pap plus HPV testing, which is the co-testing every 5 years. Above 65 years of age, cervical cancer screening is usually not required in case there have been adequate prior negative screenings. So you must talk to your doctor in detail about this. Women who have had history of cervical cancer, who are HIV positive, or if they fall into any high risk factors, might need a more frequent cervical cancer screening. Women who have undergone a hysterectomy, which is removal of uterus, also might require cervical cancer screening depending if the cervix was removed or not, or for what reason the hysterectomy was done. Is Pap test required if I am sexually inactive now or I have never had sex? Yes, Pap test is still required. HPV is present in mouth, anus, throat, and can be acquired by skin-to-skin contact and not just by the penetrative sex. Also, in case you've been sexually active earlier and not having sex now, the HPV infection can get reactivated and you could still be at the risk of getting cervical cancer. What if my Pap test is abnormal? Many women actually might have an abnormal Pap smear report. Remember, abnormal Pap smear report does not confirm the cancer. Pap smear is a screening test. It is not a confirmatory test for the cervical cancer. How much does a Pap test cost? The cost could be somewhere around rupees 500 to 1500. It could vary according to what type of Pap smear was it, whether it was a conventional cytology or a liquid-based cytology. If HPV testing was ordered along with it, the charges could vary according to various cities. Sometimes the technician or the doctor's charges also could be added to it. Also remember, many government organizations, government hospitals, certain NGOs also do the Pap smear for free. So be on lookout for them also. Next week, we will talk more about what else can be done to prevent the cervical cancer. We will talk in detail about the HPV vaccines. Yes, now we have a vaccine available to prevent HPV. So like always today, if you found this information useful, please subscribe to Maitri by pressing the bell icon. It's free. You can also subscribe by pressing the icon at the bottom right corner of the video right now. Also, do not forget to share Maitri with your friends and family. Till then, lots of love, stay safe, take care, and we will see you soon.